Allopathic medication part 11. And now we talk about the medical education. The term evidence based medicine was introduced slightly later in the context of the medical education. In the autumn of 1990, Gordon Goyot used it an unpublished description of a program at McMaster University for prospective or new medical students. Goyot and others first published the term 2 years later, 1992, to describe a new approach to teaching the practice of medicine. In 1996, David Sackett his colleagues clarified the definition of his tributary evidence-based medicine as the conscientious, explicit, judicious use of current best evidence in making decisions about the care of individual patients. It means integrating individuals' clinical expertise with the best available external clinical evidence from systematic research. This branch of evidence based medicine aims to make individual decisions making more structured and objective by better reflecting the evidence from research. Population based data are applied to the care of an individual patient while respecting the fact that practitioners have clinical expertise reflected in effective and efficient diagnosis and thoughtful identification and compassionate use of individual patients' predicaments, rights, and preferences. Between 1993 and 2000, the evidence based medicine working groups at McMaster University published the methods to a broad physician audience in a series of 25 users guides of the medical literature in JAMA. In 1995, Rosenberg and Donald defined individual level evidence based medicine as the process of finding, appraising, and using contemporaneous research findings as the basis for medical decisions. In 2010, Greenhalgh used the definition that emphasized quantitative methods, the use of mathematical estimates of the risk of the benefits and harms derived from the high quality research on population samples to inform clinical decision making in the diagnosis, investigation, or management of individual patients. The two original definitions highlight important differences in how evidence based medicine is applied to population versus individuals. When designing the guidelines applied to the large groups of the people in setting with relatively little opportunity for modification by individual physicians, evidence based policymaking emphasizes that good evidence should exist to document a test or treatment's effectiveness. In the setting of individual decision making, practitioners can be given greater latitude in how they interpret research and combine it with their clinical judgments. In 2005, Eddy offered an umbrella definition for the two branches of EBM. Evidence based medicine is a set of principles and methods intended to ensure that the greatest extent possible medical decisions, guidelines, and other types of policies are based on and consistent with good evidence of effectiveness and benefit. We'll talk about the progress in the next video and we'll try to deal with the certain medical issues, situations, and the problems.